Good morning, everyone. Welcome, and thank you for attending this morning's public session of the Oversight and Engagement Board. We are streaming live on YouTube, so if we could try and remain civil and polite, as we always are, that would be great. Thank you very much. We're going to come straight to the second item on the agenda, which is the minutes from the previous meeting held on the 18th of September. I'm going to assume that everyone's happy with those, unless I see any hands up to, no, okay, brilliant, we'll sign those off, thank you. So we come straight to one of the main items, which is the summary of local surveillance data. And Rita, I hand over to you to summarize that for us. Thank you, Rita.
Thank you very much. There is a presentation, although just to highlight that there is a newer presentation for this week, which will take into consideration the expected coming recommendations from the national team. So bear with us, there will be a newer version of this. Going then to the second slide, this is reviewing the new government guidance, and again there will be an update to this slide as well as the situation for Northamptonshire in terms of areas of concern, but the overall messages still remain the same. So going to slide 3, the rule of 6 and as part of the national guidance is the key rule. And again, we have updated this slide to also include the new regulations and the additional enforcement measures in terms of the fines and also the support for people isolating. And of course, there's changes to things like the weddings actually become now only 15, and these are already updated, but the new presentation is just going to be signed off in the coming hour or so after the government updates. So going to slide 4, also the situation for areas of intervention is going to be updated by the national team shortly. We're expected at 11 to be updated in change of situation. However, this will also have some implications in terms of the specialist support and testing availability. But again, as I said, this will be updated in the ready slides that will be signed shortly. However, in the last bullet point, in terms of incidence rate for Northampton, these have been coming down, and we'll see this in the coming slides. Slide 5 slide 5 will summarizes the public health measures, and these are remaining the same from last week in terms of some of the restrictions that we will maintain for protection of the community. And we're still reminding all Northamptonshire residents about the control measures and face coverings, and being careful and vigilant in terms of areas where people share cars or in public areas. This is the same message also in slide 6 in terms of the actions that each of us need to maintain, the distancing and hygiene measures. Slide 7 looks at the test and trace and reminds our residents how they can book testing and the availability of this in peak times. The key message is also still that people need to isolate as soon as they notice symptoms and even before they receive the definitive results from testing, and to, of course, to book for testing as soon as possible. Slide 8, next slide, shows how our testing has, and the results from those testing has been progressing over the few last months. And we can see that there is an overall, if you draw a line through these numbers of these columns, you'll see that there is an increasing trend overall from June. However, the most recent numbers have been some reduced out of these, which currently here shows up to 7th of September. These have, the more recent numbers have gone down. And we can see in slide 9, next slide, the next slide will show us the total cases by age and gender. And the picture remains similar to previous weeks, with a bulge in the people who are showing symptoms and testing positive in the lower age groups, who are more mobile, more engaged in work, and possibly more exposed and exposing others in the community. The numbers, although been decreasing, but still remain showing the same population spread in terms of age groups and male-female distribution. In the next slide, 10, there is a more updated version of this that will be released later today. And this, although this previous week data shows some areas with an upward red arrow, the more recent data actually show all the areas with a downward arrow, reflecting the improving situation in terms of numbers of cases. And the same for next slide, 11. Slide 11, next slide. And this shows the total cases to date by district and borough. And although here again, we have some areas showing significantly higher, but this is, has improved over last week. And the more recent data, which will be released later, shows all areas as either similar or significantly lower. Next slide, please. This shows the progression of the cumulative number of cases visually between the different areas. And the following slide, slide 13. Slide 13 will show us the more recent daily lab confirmed cases. And we can see that all the lines for districts and boroughs having a decreasing trend, except probably for a few upstrokes in Northampton. Although the more recent data, again, to be shared later, shows the numbers going down. And the two lines for Northamptonshire as a whole, the dashed line and the dotted line for the newer data, show an increasing divergence with Northamptonshire lower than the England rates, although this is mainly because of England going increasingly upwards. And the next set of slides, 4 slides, will show us, so slide 14, 15, 16, and 17 show us the distribution and the rates by MSOA, and this roughly translates to areas slightly bigger than wards, but can show us, and people can, and residents can see their areas and the highest, the areas with the highest rates. There is only a few differences from previous weeks. Overall, the rates have been decreasing. And if we go to the slide 18, we'll see here the number of outbreaks, summary of outbreaks and exposures, and the total incidents that have been logged across these 3 categories is 76, which is, although shows an increase, but the majority of these are exposures, which are single cases in settings, and these single cases are dealt with quickly to avoid them escalating to an outbreak. So the numbers of outbreaks have also are now at 13, which is only a slight increase. The newer number is 14. And these are also small numbers of patients, except for a couple or one in Northampton, which is a care home that has been dealt with recently. And most of the cases in that care home were staff residents, and they not residents, and they have also been isolated appropriately. So the overall picture in terms of outbreaks and exposure is also a positive one, although with the caveat that there are issues. There are still cases arising in different settings. The speed of dealing with those is the key element that helps in their control. Finally, going to slide 19 and 20 with ongoing public health actions. The key messages are still remain that we have to make sure that our residents, our population generally is very vigilant and aware of the social distancing and protection measures and the restrictions that have been applied recently in terms of the rule of 6 and in terms of groups and the restrictions on a nighttime economy, as well as if there are any calls to anyone in terms as being contacts with the case, they need to rapidly abide by the isolation rules and to be able also to protect their own families. We also encourage residents to contact environmental health and licensing team in the links attached to notify if there are any concerns in terms of the local activities in their neighborhoods. Overall, we have a positive message in terms of the current controls and the current engagement from the community, but we want to make sure that our communities are continuing to be protected by continuing to apply the messages that we have been sharing over the past few weeks. Thank you very much. I'll be happy to take any questions. Thanks.
Very much, Rita. A very thorough summary as always. I'm going to look around the room. One question I was going to ask, I know you emphasised the data being a week out of date as such, although you have indicated that the trend is good for the current figures. Can you allude to when those new figures will be out? I know we'll be sharing them at the press conference later, provided they're provided on time, but could you just give us a quick summary of when you think you will get that information? Thank you.
The information, we have it already, and it's the new pack is already ready. The only thing that's holding it up, it has been ready since yesterday, is we're awaiting this final confirmation from the national team of the change of status because it's embargoed. And once that is happened, we'll release it possibly by just after 11 when we get the release of data. Thank you.
Thank you. Worth re-emphasising that the constant flow of information and it's not always held up at our end. Sometimes it's a national issue. Let me just bring in now, I think, Rosin Harris. Hello. Are you dealing with the testing update as Sharon isn't here? Rosin, are you there?
Not muted. Sorry. Can you hear me?
Yes, we can. Sorry, there was a slight glitch there.
Yeah, absolutely. I can give a brief update on the testing, and attendees to the meeting might have seen that yesterday the national government released figures on Pillar 2 testing, so that's testing at the local testing sites and MTU sites. for every local tier authority that has been really useful, and that figures up to the 16th of September, I believe, so sometime last week, and covers the period that we've had testing challenges. The interesting thing to note in that data set is that since the variant of July, when Northampton was first sort of raised as an area of concern for the national team, and we were provided with additional testing capacity, the county's testing rates per head have been significantly higher than the national testing rates per head. And that's been the case throughout August and early September. So just to flag that, although that it's in some ways good news that we've seen lower case rates compared to other areas in the recent week, that is likely to mean a reduction in the capacity for testing locally. So we will probably see our testing rates per head come down to the national rate. In terms of other testing updates around that capacity, so we still have the 3 mobile testing units in the county and the existing local testing sites, and appointments through those testing sites haven't changed that much in the last couple of weeks. They remain steady. However, the demand seems to be reducing. So whereas we saw, I think, a third of people requiring tests having to travel far outside the county to get tests during that first week of testing capacity issues, more recently that figure's come down to only a fifth of people having to go out of county to get tested. So that's a brief testing update, and I can move on to the test and trace element and contact tracing, or
Yes,
pause there. Yeah.
Good idea. Thank you.
Yeah, no problem. In terms of, if we start with our local enhanced testing service, so this is the local team that are taking on failed contacts, those that the national team have failed to reach, and following that up. I gave you an update last week that since the service has been operational, we received 205 cases, of which 55% of those we successfully followed up and took all of their contacts details. The latest update is that we've now seen a cumulative total of 226, and our percentage successfully traced has gone up to 59%. So that's good news, and means that our sort of national total performance, so both the national team and our local efforts, mean that our total performance has improved from 72% completion at the beginning of August to 77% in mid-September. So that's also really positive. The one figure that we're still struggling with, and it's not something that the local team are involved in, but it's still with the national test and trace system, is telephone calls to those contacts. After we've reached the cases and taken all the details of their contacts, there is then required a follow-up telephone call with the contacts, just to have verbal confirmation that they are in fact isolating. So that figure is a bit lower in terms of that confirmatory telephone call. Only 62% of the total contacts that are identified are having that phone call confirmation. That's not to say that they're not all receiving, everyone automatically gets sent a text message and an email to inform them that they should be isolating, but unfortunately we're only managing to confirm that they are isolating in 62% of cases. That is a similar, it's a fairly low proportion across the board. So in the 60% sort of area for most regions, but a lot of other areas are at 69%, 70 rather than 62%. So we are hoping that improves, but again, as I say, that's with the national team and not something within our gift locally at the moment. Thanks.
Thank you, Rosin. Very good summary again. But obviously local track and trace is going to be very important going forward. So anything we can do to beef that up or help with that is a good thing. I'm looking around the room to see if there are any questions. I'm not seeing any, in which case, thank you, Rosin. Thank you, Rita. I'm going to come to Claire Hughes, and not Sarah Newell. It's going to be Claire Hughes today, who's going to give us a comms and engagement update. Hi, Claire.
Hi. Yes, I shall just go through what we've covered off in the last week. In terms of our ongoing activity, we're continuing to promote the messages as appropriate around testing across and through all our channels. And we've also been pushing the rule of 6 quite heavily through our social media. In terms of this week, in addition to that, because that's our sort of our ongoing communications, we have supported the campaign to instruct businesses, entertainment and hospitality venues who are required to download the NHS Test and Trace app QR code and put posters up in their venues so that anyone visiting could use their Test and Trace app. That's been rolled out across the county. There's been a lot of communications and engagement through all the channels, including digital, social and website. We've done a lot of work with local partner engagement on the ground and the distribution of support materials through those channels with our colleagues there. We also saw this week the launch of the national publicity campaign to publicise the NHS Trace and Test. So we've been doing our bit with that. We've put a lot of that information on our website and through our social media and digital channels as well. And we're promoting that wherever we can. We've also issued a press release around the new Healthy Schools service, which is sort of giving support to sort of around the mental health issues and sort of advising people where they can get in touch for help and how to reach out. We've had multiple communications to schools through all sorts of levels, including letters to head teachers, etc. And we've got hard copies of posters that are arriving tomorrow. And that, you know, particularly this week with sort of needing to sort of pick up around school drop-off and symptom checking. I think we've got about four different kind of poster visuals, and hopefully they're appealing. We've got the weekly press conference again, which will be, and we'll have representation from primary care this week. And we've also had 2 BBC Radio Northampton interviews, which Rosin has conducted, and they've covered off the test and trace and flu topics. And then sort of finally, we've created again, just trying to make things very appealing and sort of trying to keep the communications unboring and trying to keep people's attention grabbed. We've got a little campaign entitled John Keeping Safe. It's a little animation that we've produced, and that's now available on YouTube. And we're going to try and get that out through social media. And what that campaign is about, very simply, it shows somebody who's not adhering to sort of social distancing and good practice. And it just shows how quickly the virus can spread. I don't know whether we can show that animation now. Cheryl, are you able to?
Could be a good test of technology.
Yeah,
Let's see if that works.
Thank you. I know there wasn't sound. There is sort of a low-level music soundtrack on the back of that, but I think the visuals hopefully very sort of convey those important messages. I thought it was a more engaging way to get some of those messages across in just about a minute.
Thank you very much, Claire. I think that really is a really good piece of work, and obviously we'll all do what we can to help push that message out. I've got Councillor Phil Bignell's got his hand up. Phil.
Yeah, could you send the link to that snippet to the
Yes,
board members, please? That'd be
yes, that
appreciated.
will be, Phil, that will be going out today, along with lots of other social media tweets and Twitter sort of stuff that you can actually share. But definitely you'll get that link later on today.
Brilliant, thank you.
And it might be actually quite good if as a board we had some sort of summary of those in a note as well, if that's okay with you, Claire, if you wouldn't mind sending around an email with a summary of all the links to all those various things so that people can push them out. Thank you very much, Claire. I think that's a very good spot to end the comms update, unless you had anything else you wanted to say, Claire. I've got David Jones from Health Watch. David, hi.
Thank you. Yeah, really helpful and good to see that locally we're making a difference. Claire, I'd heard through actually my residents association that there's a consultation with young people going on. Can people register for that? It's 18 to 30-year-olds or something, am I right?
Is that the survey that was sort of going on to find out how they were being engaged with, and whether they felt that was you know, whether we were getting the message across and how we could do it better?
I haven't got it to hand, but my understanding was that there is the survey, but there's also a Zoom meeting that people can register for. And
right.
I was really pleased to see that, because I can really understand how young people are feeling very frustrated and limited, and we've seen that at universities and other things. But so a conversation with people about what's happening, how the messaging is being received, but also why it's important to be concerned not only about yourself, but what you can pass on. That's what that video so really showed, that you can actually you may be okay yourself, but you're spreading it quickly to other people. And having a conversation about how we can help people to live safely, I think is really important.
Yeah, I'll pick that up as an action. I know we have got some work going on. I don't know whether that's continuing to go on, but I'll certainly look into that. And the value of that, you know, that feedback is really good, particularly now we've got students back. And yeah.
And the survey is actually very good. I've completed it myself, and I think we had about 2,000 people at one point, but I don't know how many we've got now that have responded, because it's pushed quite heavily. I don't know whether you've got those figures today.
I will get an update and circulate them, because I know when I think it was at the beginning of the week, I was told it was just over 2,000, and I'm sure it's probably crept up since then. So I would incorporate that in my update.
Thank you very much. And if I could urge everyone to complete that survey and to send it on to everyone to complete as well. The more information we can get from that survey, the more we can tailor our response to the community, who have been brilliant in helping us so far to help defeat this virus. So this is one more area which everyone can help on. And also, obviously, the NHS app has gone live, and I have downloaded that myself, and I'm sure many other people have. And that, again, will be another tool in the arsenal, the weaponry against the virus. I'm looking around the room to see, Claire, did you have anything else to say? Oh, David, come in. Yes, David, hi.
I've just been checking the phone, and it's Northampton Borough Council, I think, a Zoom meeting on Thursday, the 1st of October, to tell us views. And it says, I can see who it's come from, and it's 18 to 39. So, Jonathan, it's the borough that's doing this, and it sounds like a good move.
Chair, can I come in there? Yeah. So we'd been in discussions with Northampton and Corby colleagues. I think Corby will follow next around setting up some focus groups with younger people, and they've used some notes that the Behavioural Insights team, the National Public Health England Behavioural Insights team, have suggested as prompts for those focus groups. So we'll be really interested in finding out what the results are.
Thank you very much. And if we could see some of those, that would be very helpful, I think, going forward. And also, obviously, the university, they're back. I don't want to put anyone on the spot, but are we doing anything specifically to target students at universities? And that might be a dual answer from Claire and Rossin. Claire, could I ask you first? Because something on Zoom with the students would probably be a very, I mean, I know we're doing other Zoom things, but something targeted at the students at the university would probably be a good thing. Claire?
I know that we've got an open dialogue with the university in terms of how we can engage better with the students and get messages and get feedback. So I'll take that away as an action. I can't speak because I don't know the detail on that, but Rosin might know. But I definitely know that we've got an open dialogue with the university. So as an idea and a concept, it will probably be very easy to instigate.
Yeah, I'd say the same. I think it was raised as a next step after the initial focus groups in Northampton Borough. I think the team there were keen to take that forward, but I'm not sure if that's progressed.
Well, I mean, it's all brilliant news. I mean, the comms team have done an amazing job to date, as we all know, and continue to do an amazing job. But this is just one other area that we can consider perhaps next time we meet. But provided you've got time, of course, I know you're all very busy. Chris Stamborough, you wanted to come in. Hi, Chris.
Thanks, Ian. Yeah, I just wanted to ask whether Rossin can tell us any more about the planned focus groups in Corby, if we know putative dates on that yet or anything like that, and to ask, and I'm sure this will happen, that Corby-based councillors are kept informed. Thank you.
Yes, no problem. So the short answer is because of, I guess, capacity in the team, and over the last few weeks, the change in guidance and all the new regulations that have come out, I think the plans for the Corby focus groups were put on hold. A, because of all that other activity that's been going on, and B, because there were so many responses from the to the online survey. We felt that it was best just to hold back, see what we learned from the survey and from Northampton's focus group before then ploughing ahead with Corby. And then the third in the line was Kettering was going to follow on after Corby. So I don't think we've got any dates in the diary for Corby yet, but we'll let you know as soon as possible.
Thank you. If you could keep us informed as to progress on that, that would be very good. I'm looking around the room to see if there's any further questions. In which case, any other business? Rossin, did you have any other business?
Nothing from me. Thanks, Councillor Morris.
Anyone wanted to raise anything in any other business? No, brilliant. Thank you very much. So we've got one more meeting date. There are more to be organised, but the next meeting is on the 1st of October at the sprightly time of 8:30 a.m. I know we all love those early starts. Thank you very much, everyone who's come today. Thank you for the questions. Thank you for the presentations. See you on the 1st of October at 8:30 a.m. Thank you very much. Stay safe, everyone.